Hello, everyone. I'm Pharmacist Michael, and today I have the beautiful Jules with me, and we are going to talk about something that I've been interested in for a very long time, and that is ECT. And Jules has some experience with this. But before we start talking about ECT, I want to ask you, as far as depression goes, how long have you had it, and what have you tried before ECT?
So, um, I first had it when I was 5. That was like the first moment that I felt something. I didn't know exactly what it was per se because I was only 5 at the time. But now that I'm older, I know, oh, okay, that was depression. That's what that was. So I was 5 years old. Really little.
5 years old.
Yep, 5 years old, really little. Um, I have tried everything as far as medications go. I've been on Prozac, Zoloft. Those are the first two that they really try on everybody. I've been on some Cymbalta. I'm allergic to Wellbutrin. So because I'm allergic to Wellbutrin, that means I'm going to be allergic to that entire class of antidepressants. So I have to stay away from those. I'm trying to remember which class that it's under, but I can't think of it right now. Let's see. I've tried lithium. I've tried mood stabilizers. I've tried Lamictal, which I'm actually allergic, or I got the Johnson or whatever, the rash.
Stevens-Johnson syndrome.
Yep, I got that. So I can't do Lamictal. I've tried a lot. I have a whole probably 2 pages worth of medications that I've been on. And so for me, they do the adverse. So instead of making it better, it makes it 10 times worse. And
Oh,
I don't recognize myself on them. I get more suicidal on them, and yeah, it's really scary. So yeah.
okay. So you've tried. Hi, Cam. Thanks for coming in. So you tried the meds, and usually that's what happens. They always try the meds before ECT. So what
Mhm.
made you want to try ECT?
So I have I have a lot of trauma in my lifetime. We'll probably have to do another interview for
Okay.
that. But yeah, so I have a lot of trauma. I'm not going to go into too much detail right now with it, but about, I would say, 2 years ago, ECT was first brought to my attention or suggested, and I was like, oh, that's really scary. Kind of thing. And I was really hesitant on even wanting to try it at first. But I had been in and out of the psychiatric hospital for 2 years straight, just going through a lot of flashback, PTSD, that type of thing. And for people that don't know what PTSD is, it's post-traumatic stress disorder. And the flashbacks that come with it, they can actually take you back to the time that the trauma had happened. So there's been some cases where you have a flashback or a trigger that triggers the flashback, and then your brain takes you back to when you're 5 years old. So there's been people who revert to a 5-year-old self. So
Right.
talking to you, they talk to you like they're 5 years old.
Right.
So yeah, that's been what I've been struggling with for a long time, not just the last 2 years, but a really, really long time. So when it first got introduced to me, I was really scared and I was really skeptical, because what it stands for is electric convulsion therapy.
Right.
And it's where they essentially medically induce a seizure. And what they think that that does is reboots the brain, and it's kind of like a reset button. You have to have it done quite a few times. I've been told by my doctor to really start noticing a difference. So it really just depends on the person and your brain. Um, but they say anywhere between 8 to 12 for the first like series. But you are put to sleep for it. You're not awake. So it's not like anything that you're going to feel or anything like that. Because trust me, if they would have told me, yep, you're awake for it, I'd be like, yeah, no, we're not. We're not
And
doing that.
I also want to let everybody know that they actually stop your muscles from contracting. The only seizure happens in your brain. So a lot of people think, oh my God, I'm going to be laying there shaking around on the table. But I've actually witnessed ECTs before, and they really don't move because they use neuromuscular blockers.
Mm-hmm.
So it's not some crazy violent thing at all.
Yeah.
And the other thing I will tell you is I've personally seen patients who were so depressed and so far out of it that they wouldn't even talk to people. And after a few ECT sessions, looked almost normal. I mean, they wouldn't even eat before. So this is not something that is a crazy thing to try at all. And it does work in a lot of patients.
Yeah.
So have you felt, how many sessions have you had so far?
So I have had, this will be, so last week was my 10th
Okay.
one. So you go in 3 times a week. So Monday, Wednesday, Friday, they like to give a day in between,
Mm-hmm.
to like, let your body kind of recuperate and stuff like that. So then now I graduated to graduated to 1 time a week. So now I just go in like every Wednesday, and we'll do that for a couple of times. And then from there, if I'm still doing okay, then we'll move to 2 times. So like 2 times a month. So that's like every 2 weeks, and then so on and so forth. So they taper you down from what you were doing. Um, and I will add too, so ECT treatments is for people with bipolar disorder, or very like mania, who's very manic, people with major depressive disorder, which is what I have, but medication resistant. So we've tried all the medications and stuff like that, and nothing's working. It's also for people who experience like psychosis, people who experience, I think it's called catatonia, and that's like where
Yep.
you are just in bed. That's it.
You
You wake
don't
up.
respond to external stimuli if you're catatonic. So you can talk to somebody and they'll just look at you with a blank stare.
Yeah, exactly. And in those situations too, I've been told like their hair, like too, will be so matted, like it will just be like matted to their skull. Like it's really bad. But there's so the statistics behind it is, so ECT actually works 85% better than medications do. So medications is about 55%, and ECT is 85%, but it's specific to certain diagnoses and symptoms and stuff like that. So it's not like the first go-to thing, because it's more invasive.
Right.
Um, but I will say though, like for me, like my depression has lifted so much. Like before, it was a really thick fog for me. Like I couldn't concentrate on things. If I started to do something, I would just be so overwhelmed with like other things going on in my brain. Like, oh my gosh, okay, I gotta go talk to my daughter for a second because she needs this, this, and that, or like I need to go hurry up and make dinner, or stuff like that. So my brain was always like going, 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 never stopping. And then with my like the lower part of the depression, it would get really, really low. So and it would stay that way for like a few weeks to sometimes a couple months, etc. And then sometimes so for major depressive disorder, you have a baseline and then you dip really, really low. And then you go back to your baseline and then you dip really, really low. So it's kind of like this. And then with bipolar, you're at your baseline and you go up and then you go mania. Right. And then you go back to your baseline. You go up mania where you don't sleep for days on end, like that kind of thing. Yep. So I honestly, like cognitively, I'm able to concentrate better on things and conversations that I'm having. I'm able to be more mindful about like where I'm at, what I'm doing, that kind of thing. I don't want to die.
No, anymore. I don't want you to die.
Good. Yeah, that's like with the depression though, it's
right.
Like, that's something that I've really struggled with is like, okay, well, like, why am I here kind of thing? Like, what is my purpose? Like right. that sort of thing. So with ECT, it's lifted that for me to where like I want to live. Like I'm more hopeful for my future because like I finally found something that actually works. Good. So yeah.
So Janet and Kim says she can't hear us, but I can hear Jules just fine. Janet, can you hear us? And if you guys have any questions, please ask, because this is a fascinating topic. Another question I'm going to ask you is, have you tried ketamine at all?
So ketamine has been offered to me. It is FDA approved for things like this. And it also, so ketamine also can be used for chronic pain. Yep. Too, which is, I also deal with chronic pain. I have endometriosis, scoliosis, and a whole bunch of other things wrong with my spine. That's always what I tell people because there's a lot wrong with my spine. I'd be here for a while explaining it. So
we're just going to have to do a series of interviews with Jules. We can talk about trauma. We can talk about spinal problems, and we can talk about ECT.
Yep. Yep. And trauma.
Yeah, trauma.
I've got a lot of that and PTSD and all that other good stuff. Well, not good, but it starts the conversation for things like this. So yeah, like ECT, honestly, I thought was really scary. And I was really getting in my head about it. Like, oh my gosh, like I'm going to be a vegetable. I even went as far as like before my first treatment ever, I went as far as to sign an advance directive because I didn't want to be a vegetable. And if that should happen, because, you know, with everything, every procedure, there's risks. And so I just wanted to make sure that, you know, if I was going to be a vegetable, like there's things that are worse than death. And I think being a vegetable is worse than death. So yeah, but ECT, honestly, it's not scary at all. Like you're literally asleep like the whole time. But basically what they do is they will put a blood pressure cuff on one of your legs or they will put it on one of your arms. And that's just so that they can see the seizure starting. Which is it only like so you only have like the muscle like tension for like 20 seconds, and then after that they monitor your brain waves. So you're still seizing after that, but if it goes past a certain, I think if it goes past 2 minutes, they'll need to intervene and stop it. But you don't convulse, you don't like you know, flop around like a fish or or anything like that. You do twitch when they give you the muscle paralytic, and that's just your muscles kind of like relaxing and releasing that tension that's in your body like naturally. So you might see a little bit of twitching, but that's not even from like the ECT at all. That's just from the paralytic. And then once you're asleep, they make sure you're asleep too, because you don't want to be awake for it. And then they shock you. So basically the paddles that they would use for your heart, it's the same kind of like mechanism that they use for your brain. So they'll put, so you'll have like two what are those like?
Electrodes.
Electrodes, one right here, one right here. Then you have one right here, and then you have, of course, like your heart monitor to monitor your breathing and your heart. And then they put gel like on the side of your. It's so hard to get out of your hair, but they put the gel on here, and then they put one back here, and then they'll shock you for 6 to 7 seconds. So like, clear everything, and then you'll start your seizure. And then from there, you're sleeping. Like it's a very calm process. Like it's a lot calmer than I had expected.
Yep.
A lot more boring than I expected. I thought
So
it'd be
how many sessions did it take before you noticed a difference? Did it happen right away?
no. Well, I mean, okay. So after my first session, I did notice a little bit of like energy returning, because with my depression, like I just did not have the energy to do anything. Like I would literally have to force myself to do things. And that's the thing about me. So my depression looks very, very different to someone else, like the book form or the DSM-5 form
Right.
of depression. So with me, I put on a mask. So I just put on like a happy face and I force myself to get through the day. But really inside, I'm like, my energy, like I'm exhausted all the time. So it took me it took me a lot inpatient this last time that I had to go, to convince this doctor to continue to do the ECT, because he was like, well, you don't look like you have depression, so you're not depressed. It's like, that's not how.
What?
Yeah. Yeah. But luckily he wasn't the doctor that was doing the ECT, and the doctor that's actually over the ECT was like, what is he talking about? Like,
Yeah, you can't tell if somebody's depressed by looking at them.
exactly. It's like it's in their minds. That's what
Right.
psychiatry is all about. Like you have to tell, like talk. It's talking and explaining like what's going on with you. It's not, oh yeah, this person's this way, or yep, that person's that way. Like no, that's not how that works. So
So the first you got energy back, then
yeah.
what? How many more treatments
Um
did it take? I mean, how do you feel right this second? You've had 10, right?
yeah, yeah. So it took me about maybe, I think on my sixth or seventh treatment is when I really depression aspect of it changing for me.
Okay, so 2 weeks in, right? Because you were doing it three days,
Yeah,
three
so
days a
that would be
week. So the second
so
Friday,
about like a 2 weeks in a day.
2 weeks in a day. Okay.
Yeah. Um, which is good, obviously, that's what you want. But I've also noticed a couple of other kind of crazy things, like memories have come back to me, like so
Good memories
having
or bad memories?
good actually.
Okay, that's awesome.
Yeah, because so with my PTSD and my trauma, my brain had shut out a lot of my childhood, a lot of like everything. And every time anybody would ask me, like, oh, like, what good things are there in your childhood? I'm like, I can't remember.
Yeah.
So I've had a lot of good memories come back to me of my childhood. So that's really good. I'm quicker to use coping skills. Like it's more in my mental default now. Like they've always been there, but there's just been a disconnect. Like there wasn't like a neural pathway that was connecting the two. And that's essentially also what ECT does. It helps you create new neural pathways to better use your coping skills and better, like handle things and stuff like that. And yeah, so
Okay, and you're a psych nurse, right?
yes. Hmm.
So that's what you're doing now is you're helping other people,
Yeah,
some
I've
of
had
which
to
have
take
the
a step
same
back from
condition that
it.
you have.
Yeah, so with my own mental health and stuff like that, I've had to take a step back from it.
That's
But
okay. That's
yeah,
okay.
yeah.
You've got to take care of yourself before you can take care of
Exactly.
anyone else.
Exactly. And I was busy trying to help everybody else and I was not helping myself. And that's what got me like really, really bad and just went downhill from there. So it's like you have got to help yourself before you can help
Yep.
anybody else. Like you just can't. Like, yeah.
And you have some good things going for you. You've got
Mhm.
a supportive spouse for sure,
Yeah. Oh, yeah. Absolutely.
which that is a huge positive.
Yeah. Support system is. And see, okay, here's the thing. Like, a lot of people think that support system means your family. Like, no, it doesn't always mean like your family.
Right.
It could be your friends. Like, just because they're blood doesn't make them family.
That's
Whoever
right.
is going to be there for you and actually be there for you, like, that's good. That's a support system. Boundaries, though,
Yes.
for sure.
Okay, so what would you tell somebody who was severely depressed that said there's no way I'm ever going to have ECT because it's traumatic or it's, you know, the one flew over a cuckoo's nest type
Oh, yeah.
thing?
I
What
honestly,
would you tell them?
so I've heard that a lot, honestly, because that's what people think it's
Yeah,
from that movie. Um, but honestly, it's like, what else do you have to lose? You know what I mean? Like, if you've tried everything else and nothing is working, most of the time people just want the pain to stop. It's not that, like, like, okay, like for instance, somebody who's like suicidal or something like that. They just honestly, most of the time, just want the pain to stop. And they see that as a viable way to make the pain stop right then and there. So it's like everything that you've tried up to this point hasn't worked for you, but research and studies have shown that this has been very effective for people just like you. So why not at least hang on until you at least give it a try and see how you're doing? Like
and
from
the other thing I would add to that is for everybody that's listening to this out there who's depressed and has been offered ECT that thinks it's nuts, is things are a lot different now than they were in the 70s.
mm-hmm.
So they didn't used to block the muscles, so the people did have seizures, but now all that has changed.
Yep.
So, and the process is a lot more refined. They've gotten a lot better at it. And it's
Mm-hmm.
really not a scary thing. I mean, I've worked in 2 hospitals that have done this in my career. And like I said before, I've seen some pretty amazing results from it.
Yeah, it's honestly, it's for me, it's been life saving. So,
Right.
like, I would probably tell somebody, it's like, what would you do if you didn't have depression or like it was more manageable, you know? Like, this could be the answer for you. So it's like, why
Right.
not at least give it a try? Like, I mean, you put in drugs into your body that you didn't know what the side effects were going to be.
That's
That's
right.
really scary too. So it's like, why
Yes.
not just at least give this a try too? Um,
There are drugs out there, especially the antipsychotics, that have some side effects that may never go away.
yep, like
And we've
tremor.
all seen patients with those. I know you've seen them because you've worked in that field.
Mm-hmm.
So, you know, yeah, there's side effects to every treatment, basically, pretty much. But ECT is not a scary thing. It's
It's
not.
really not. I honestly, I think so. I don't know if you knew this or not, but ECT, how they discovered it was they actually used it on the battlefield as an anesthetic.
I did not know that.
Yeah, it's pretty
Wow,
crazy, right?
that
So,
is crazy.
I guess like so one of the doctors was just telling me that so a guy like he would need surgery to get either his leg amputated or something like that, and they would perform ECT on this person and make them go unconscious
Right.
through having the seizure, but then they would wake up and their depression would be gone.
That's amazing.
So it's like, I think we're onto something here.
Yeah.
But
Wow.
yeah, like it's not like, another thing that I thought ECT was before going into this, I thought it was a lobotomy.
Right. No, it's not.
It's not that at all. They don't do that anymore at all, period.
Okay, Kim, this is Jules. I know you've seen her in my lives. She's a good friend of mine. She's one of our TikTok.
Housewife Mafia. You guys might know me by.
She's Housewife Mafia. I'm
Yeah.
sure you've seen her.
Yeah.
She's also in the Snapchat group.
Yeah.
So she's definitely a frequent flyer to my lives and one of the people that I've really been looking forward to interviewing for a long time. So that's who we're talking to here.
Yeah. I can't see comments or anything. Otherwise, it'd be like.
Well, I can pop them up here for you, but I don't know if you can read them because you're
Yeah,
a little
I
ways
don't know.
away. So
okay, yeah. Hi, Kim.
She wants to know who you are.
Hi.
And if anybody's new to this, we're talking about ECT, which is electroconvulsive therapy. We use it for psychosis, we use it for depression, and we use it for bipolar disorder. So it's basically using electricity to cause a seizure in the brain.
That reboots it or restarts it.
Reboots it. Janet, questions? I know you got to have questions for Jules. I know she's in here. Janet usually asks a lot of questions because she's very curious. Yeah. And there's,
I did ask my doctor if he could record my last session, and he'd let me, but I'm not allowed to share it online. Sadly.
Oh, okay. Well, that's fair.
Yeah.
That's fair.
I get it too. It's because like a lot of people are, I mean, it's like mental health in general. A lot of people get the wrong idea about ECT and they go after the doctors, and it's like, that's not necessary. Like, it's helping. Like,
right. Or they'll pick it. It's people, and some of it is just because they don't know about it, right? I don't know.
Yeah.
I'm all for different therapies besides drugs, that. Mm-hmm. And I think, I'm not saying if somebody's depressed, they should go straight to ECT at all. But if they've tried the drugs and they're suicidal, then.
And like a big thing of what people are finding is that with depression, that like suicidality comes from depression.
Right.
There's a connection.
Absolutely. So Janet wants to know if there's a recovery time. I'm assuming that means after a session.
Yeah.
So what's your recovery like?
So basically all that you're really recovering from is, I mean, you're recovering from the seizure, obviously, but the biggest thing that you're recovering from is the anesthesia. So if you've had anesthesia before and you do well with anesthesia, like me, I've had it a lot, then you're going to recover pretty quickly, because I wake up fast, I go to sleep fast, I wake up fast, I just metabolize it really quickly because I've had to have anesthesia quite a bit. But they say to take the day. So normally your treatments are early in the morning, and then you take the rest of the day to kind of recover and recuperate. However, me personally, I like to take 2 days just to, like not calm down, but like
recover.
Give my body time to
recover.
Yeah.
Which I think is reasonable. I mean, I think you're doing the right thing. I think taking some time off from your job, taking care of yourself, is going to pay dividends in the future that are way bigger than trying to force yourself to do everything at once.
Yep, exactly. Like, because eventually it's gonna
yeah, you're gonna thank yourself.
Yeah,
right.
Like it did.
Right. And you were doing a lot of stuff, right? I mean, you were working, you were going to nursing school.
Yeah, I just
got kids to deal with.
I was babysitting throughout the week. Yeah, over the weekend I was working. in the inpatient psych as a nurse. So,
And you probably weren't getting enough sleep. And we all
no.
know if you don't get enough sleep and you have any type of mental health disorder at all, it's going to get worse. It doesn't matter what it is. You have
Yeah.
to sleep.
Oh, yeah. And then I have a 12-year-old on top of it. So
Right.
that's, but yeah, I was doing, honestly, I think that I made myself so busy that I thought that, oh, well, if I make myself really busy, then I don't have time to think about what, like my depression. Like I thought I could just, put it on the back burner and leave it there. But nope, it's going to boil over at some point. It's always going to boil over at some point.
So explain to us what the worst day is that you had before you started this.
The worst day that I had.
How did you
Um,
feel? What
so
was it like?
I had a PTSD flashback. I smelled a smell of my abuser, and it can happen at any time. Like it doesn't matter, like what it is. Like I don't know until I smell the smell, kind of thing. So I smelled the smell, and it took me back to when I was 5. And it took me back to that child like brain. And what I did back then to try and get out of that situation, to get away from my abuser, was eat inanimate objects that you're not supposed to eat. So my mom would take me to the emergency room. So
Wow.
yeah, like I had no idea like what was going on I had no idea what was happening. But I get when I woke up or when I came out of my flashback, they had told me that I had ingested a battery. And I'm like, no, I didn't. Like, you're lying. Like, no, there's no way.
Oh, so you did that this time?
Yeah, because I was
Oh,
in, like, my flashback had taken me back to that age and back to that, like, what I had done back then. And I blacked out. Like, I don't remember any of it at all. Like I just remember waking up in the hospital and they're like, yeah, we're going to have to potentially do surgery. And I'm like, what are you talking about? Like, where am I? Like, why am I not at home? Like, so yeah, it can get like PTSD is a really, really real thing. And
yes.
not a lot of people really understand it.
Right. The answer to your question, Janet, is yes, it is widely available in the US. There's a lot of places that do ECT.
Yeah, it's
There's a lot of
FDA.
hospitals that do it. There's a lot of clinics that do it.
But yeah, as far as depression goes, like my worst day for depression, I've had a lot of really bad days with depression. It just feels like you're never going to be good enough. Like no matter what you do, no matter how hard you try, like there's always going to be someone or something out there that's better. So it's like, why even bother trying anymore, kind of thing, like. So once I got in that rabbit hole, like everything spiraled from there, and your thoughts are just like going, like they don't stop. So, and like either a lot of people will either cry or they'll get angry. And for me, it's kind of both. Like I get really angry and I cry. Like I'm an angry crier. So
Wow.
yeah, but yeah, that time I think that was one of like my more serious attempts of suicide. Um, so yeah, trigger warning if anybody gets sensitive over talks of that. But yeah, like maybe I'll go into detail in the next interview about it. But
When you're ready,
yeah,
we don't have to talk about anything you don't want to talk about right now because that's not why I'm here. I'm here to help people understand because there's a lot of people like you, Jules. There is. There's a lot
yeah,
of people out there who may not even know what happened to them, may not even know why they're feeling what they're feeling, may not
right.
know what ECT even is.
Yeah. Honestly, like it's really sad too because So I had actually been misdiagnosed for years. I had been told that I have borderline personality disorder, but I don't have borderline personality disorder because they look at your trauma and they think, oh, automatically borderline. But it's like, no, you have to have 5 of the 9 in order to even be diagnosed. I have 1, I have trauma. That's it.
Yeah, I
So,
mean, borderline personality disorder, and once you're diagnosed with that, it's hard to get care because the doctors don't want to deal with you anymore because those people are super manipulative and they really do make it hard on the staff in the
oh, yeah,
hospitals, even though they need help probably as bad or worse than anybody else does.
right.
Just because you've been abused doesn't mean you have personality disorder or doesn't mean you have borderline personality disorder. But if you have it, you were probably abused. That's the thing,
Yeah,
because that's built into your personality because of what has happened to you.
right.
So,
Yeah, it's just unfortunate because, like, for me, that's all that they would look at. Like, once somebody
right.
tried to say that I had that, um, and then they stopped, like, paying attention to my depression. Like, I'm like, dude, I'm sad. Like, I could be fine. Like, there could be nothing wrong. We have all the money in the world. Like, okay, for instance, 2019, me and my husband, we just built our first home. We just moved into our first home. We just got a new Great Dane puppy at that time. We had all the money in the world. My husband just got promotion. I was a stay-at-home mom at the time. Everything was like going great. I was doing mindfulness things, but I was still so sad and so depressed. And I would tell my husband, I am so depressed. And he was like, why? I'm like, I don't know. Like, I just don't know. I just
Right.
am.
Yep.
So, yeah, like that's why depression looks different in every single person. And it's also why I wish psychiatrists would treat the symptoms and not the label. Because I feel like when certain labels are put on you, that's the only thing that they treat is a label, not the symptoms. It's like a blanket.
Yeah, I'd be careful when you say psychiatrists because they're psychiatrists are just like everybody else. There's good ones and ones that aren't so good, right? So
Yeah.
I think a lot of them do pay more attention to
Yeah,
their
not all
patients.
psychiatrists are like
Right.
that. There's some good psychiatrists out there that I've
They're
dealt with.
great ones. Oh, there's
Oh
there's
yeah,
real
absolutely.
good ones.
But there's
But
some out there.
remember, a psychiatrist is just like any other medical professional now, and they really are rushed through things and they have to
Yeah.
spend a lot of time charting, and they don't get to spend as much time with the patients as they probably need to.
Yeah. Mm-hmm.
And that is a problem that our healthcare system has now, especially with Epic. They're you've got to make sure that everything's done in that chart because of legal reasons, especially if you're a psychiatrist or an OB
Oh,
doctor, somebody that's at high risk of having a lawsuit filed against them.
yeah, I agree.
So, but I'm glad that you were willing to try this. I think it was a very reasonable treatment for you. And, it just may have saved your life.
Oh, absolutely. I'm 100% certain that it did save my life.
And I mean, if you're eating batteries and not remembering,
Yeah, that was 2 years
that
ago.
that can be, oh well, even then,
That was
no,
a
it could
while
that
ago.
could have been, I mean, what if you drank gasoline or something? You just don't
Yeah,
know.
right. Well, and
So,
that's why like because okay, anytime that I've ever like told that story or anything like that, people will look at me and go like, "She's crazy." Like
it's disassociation.
it is, and people don't put disassociation with PTSD. People more so put disassociation with other mental health illnesses.
Yep.
But it's a very real thing with PTSD. Very real.
Yeah. I mean, absolutely. I mean, I don't know if you were in here when we had the Army vet in here,
I don't know if I was.
but he had some real difficult he has problems even going to dinner with his family.
Yeah.
Little things set him off from combat, right? So
Yep.
there's a lot of different kinds of PTSD too. There's you know,
Oh yeah.
sometimes it's stuff that didn't even physically happen to you. It could have happened to somebody that you loved, right?
Exactly. Yep.
Finding your grandma deceased or watching somebody die in the battlefield or something like that.
Yep.
So there's a lot of people that have PTSD, and like I said before, might not even know it.
Well, because trauma is subjective, right? It's all about a person's perception
Yep.
of the trauma. Like it could, so one thing might not be super traumatic to one person and like, oh, like, that's whatever. But then to another person, it can be life changing. Like, oh my gosh, that was really traumatic, you know? So I always try to give people the benefit of the doubt as far as any of that goes. I try not to judge. Um, and just, because just because I don't know, and that's the thing, like, you don't know how somebody else feels. Like nobody does. Like, you know how you
Right.
feel, like, but you can't take somebody's brain and put it into your head and be like, oh yeah, totally. I feel that.
Okay, Janet, I don't know the exact answer to this question. How long has this treatment been available? I'm going to guess.
So it
Do you
started,
know?
I actually do.
Okay, good, good, good. Because
So they first discovered it in 1935. That was the
how
first
long have they been
discovery.
using it for depression?
So ever since then. So when
Oh, wow.
yeah, so that's when it started. And that's when they were doing the whole, so in the mental hospitals, instead of sedating patients, they would just,
Yeah.
yeah.
And
So,
that's where it got its bad name from because
yep.
people think it's barbaric,
Oh, yeah.
but it's
It's really
not.
not. Like,
No, it's not.
no. Like,
In fact, we used to have our students go watch one as long as the patient agreed to let them, just so they knew what it was like. I mean, I've seen several just because I've
yeah.
had to run stuff into the room while they were doing it. But it's
It's,
really
it's really boring.
it
Like,
is.
you're
It
just looking
is.
at somebody sleeping. That's all you're doing.
That's it.
Like, yep.
That's what it looks like. It looks like somebody sleeping with electrodes on them. That's it.
Yep. And the little breathy thing.
Yeah.
That's about it. Yeah.
So how long do you have to do this? How many more treatments do you think you have?
Um, so it all depends on the person. Since I'm already doing my like once a week thing, we'll do that for a couple more, and then we'll go to 2 weeks, and then go to 3 weeks, and then a month, and then 2 months, 3 months. So it all depends on my brain and how like it adapts to the treatments. But if I relapse, I'll say
Right. Then they'll go back to the beginning.
then not necessarily at the beginning,
Oh, okay.
add more frequent
Right.
sessions. So then that's when they know that, oh, okay, so like her brain does well this long after like this frequency. And then so that's kind of like an indicator of in the future, because it's about maintenance, right?
Right.
Like with medication, same thing, it's maintenance. It just all depends on the person and what their brain needs to, so you don't really know until you try.
How do you know when it's time to go back to work?
um Honestly, I think I'm just about there. I think maybe another couple weeks, possibly. I think it's called FMLA or FLMA
Yep.
or something like that. But that's what I'm doing right now, and I'm just using PTO. Um,
Okay.
but I think I just need to be honest with myself
I
and do
agree.
check-ins with myself and be like, okay, like how am I doing today? Like what's going on? Like how am I doing mentally, emotionally, physically? What's going on? but everything's heading in the right direction though. So hopefully not too much longer.
Okay, so Janet said that her aunt went through this type of treatment in the UK in the 60s and it changed her life. And I believe that. I believe that.
Yeah, I
It
have.
was different back then, but if
Yeah.
you're severely depressed or psychotic or anything like that, then
Yeah, honestly, like thinking about it, like if I didn't have sedation, I don't know, I still might do it because I was at a point where
yeah, you
it,
get to the point where there's no reason to live and you just want to feel normal again and you're
yeah, I wanted the pain to stop.
right.
I wanted it to stop.
That's right.
Yeah.
And it did, or at least it's better,
Yeah.
right?
Yeah. Like, I mean, this is not a cure. Like, I want to make sure that like people know it's not a
Right.
cure. It's not a cure all. I've had bad days.
Yep.
But it's the fact that I can utilize my coping skills better, um, and be able to like get a hold of things better. Like clarity, I guess mental clarity is a thing. Another thing that I forgot about, okay, so after the treatment, some patients, actually a lot of patients, they get what's called ataxia,
Right.
where things like names and stuff will be like on the tip of your tongue, but you just can't think of like the name of the thing, and it's in your brain, but you just can't say it, kind of thing. Short-term memory loss is another
Yeah.
one. Um, yeah, I've had that.
Too
Um,
bad you can't get rid of the trauma memories.
I know that's what I was thinking. I was like, well, shoot, if you could get rid of that, they're like, yeah, no, that's more long term. And I'm
Right.
like, well, crap.
Yeah.
But it's okay, honestly, because I look at my trauma and I'm like, well, my trauma is what made me who I am today.
Yep.
And I wouldn't be where I'm at today, and I wouldn't have the child that I have today or the husband that I have if I didn't go through what I went through. Like, yeah.
But your
So,
husband didn't even know all this happened to you until fairly recently, right?
he
He
kind
didn't
of,
know
sort
details.
of, yeah, he kind of, sort of knew, but he like, I didn't really share a lot.
Right.
Yeah. And that's another thing, like with depression, it's like you don't really want to people. You don't.
Right. And we're a social animal.
Yeah.
So you miss a lot when you don't have the love and care of other people.
Exactly. Yep. Because we need that social connection.
Yep.
We need it, like to live
Yep.
and
That's
survive.
right. That's right.
Oh yeah.
They've done lots of studies on babies,
Oh
you
yeah.
know.
Yeah. It's so sad. Like I've seen some of those studies. I think it's in like Russia, like where they just don't hold any babies, and those babies actually end up dying.
Yeah.
And it's like that's crazy. Like we
Yeah.
need human connection. We need touch. We need it as humans. So
Yeah. All animals need it.
true. Very true.
Yep.
We're animals. Rawr. I'm just
We
kidding.
are. Is there anything else you want to tell these beautiful people out in the audience?
Um, just anybody struggling with depression or anything like that, just know it is an emotion. Technically, depression's an emotion. Um, it's not forever. It will pass. I know it's cheesy, but this too shall pass.
Yep.
But yeah, like just hang in there, one day at a time, one second
Don't
at a time,
forget to
1 minute
try
at a
new
time.
treatments.
Mm-hmm. Be
Don't
open.
be
Keep your mind
scared.
open. Open
Right.
minded.
Yeah, the next thing you try may be what makes you thrive. You just don't know. Everybody is different.
Yep. And statistically speaking, so suicide, it affects a lot more people than you might think. Um,
Oh, yes.
yeah. So just it's thinking about too is like the people that you're leaving behind. Like you're actually affecting them more. Um, so yeah.
Yes. I I think that people just get to a point in their lives where they have nothing to live for.
Yep.
And they've convinced themselves that the whole world is better off without them. And when I talk to people like that, and I've had several conversations with people like that, I always tell them God doesn't make mistakes. You're here for a reason.
Yep.
And what you're going through now, you're going through for a reason. It's hard for people to really believe that. But like you said, it changes you into the person that you are. Like me, I've had depression, but my big thing was really bad anxiety. When I was younger, it was horrible. I mean, I thought I was going to die pretty much multiple times a week.
Yep.
But now, because of that, it forced me to learn how to deal with it. And it's enabled me to help other people with the same problem.
Yep.
So I think it was all done
For a
for a
reason.
reason.
Exactly. Yep. We
And
go
I
through
get
stuff for a
a
reason.
lot of joy out of helping people get better. And obviously
Yeah.
you do too, or you wouldn't be a nurse.
Me too. Yep.
You wouldn't be a nurse. That's what nurses do, right? There's a reason you went into nursing, and there's a reason you wanted to be a psych nurse.
And honest to God, like I think it's interesting to see people who deal with trauma are the types of people that want to help others and are
Exactly.
more selfless, are more empathetic of other people and stuff like that. Like people who have dealt with trauma, those are the nurses, those are the doctors, those are, you know what I mean?
Yeah. And I think that most people that go into psych have some sort of psych background, maybe not in their lives, but at least in their family or friends, or they know
Yeah.
somebody. Because if you, a lot of people are scared of psych patients, they're like, oh my God, that guy's psychotic. All they can think about is Halloween and these movies where some guy's running around with a knife stabbing. And that's just not like that.
Yeah,
Most people with mental illness are not violent.
exactly. Yep.
And I tell people that and they think I'm crazy, but I've been around so many people that have mental illness in my life, and I have never felt scared or threatened by them. I mean, I felt threatened by people that didn't have mental illness, I think, more than I have ones
Same.
that did.
Yeah.
Yeah.
Like there's
So,
still people too, like just like with like Gero patients, there's still people, or like people with Alzheimer's. There's still
yeah.
people. There is still a person in there, and they deserve to be treated like a human being.
Yes, Kim, and you do a lot of teaching with the scripture too. I mean, it's not just lupus. You're another person who helps people every day. So,
And that's awesome.
really, I am a person who believes that the more you help others, the happier you become.
Yep.
And I'm not going to say that's true for every single person, but I think it's true for most of us
Yeah.
because there's a certain gratitude, something that you get, joy, I think might even be the word, that you get from helping someone who can't do something without your help, or just, I don't know,
It's
you,
service. It's service, doing service for somebody else. Like it.
right.
Yeah. Like that's special. You're doing something special. You're going out of your way for somebody else. That tells that person that, oh wow, this person cares. You
And
know.
you are going to help so many people for a couple of different reasons. One,
Well, thanks. Yeah.
because you're doing this on purpose, but two, and this might be the most important thing that a lot of people don't think about, is somebody that has PTSD is going to listen to somebody else who's been through it a lot more than they are someone
Mhm.
who hasn't. It's kind of like a drug addict.
Yeah.
You can't, it's really hard to tell someone to stop using drugs if you've never used them, because they're like, you don't have any
Yeah. You
idea what
don't
you're
know.
talking about. You've
Yeah.
never been where I've been.
Yeah. Exactly. I agree. 100%.
So not only does it make you want to help people, but it makes you better at it because the people you're helping listen to you and they respect you and they believe you because you've been there,
Yeah.
and you give them hope because
Exactly.
now you're a nurse, and they might be because they're in the hospital, they're thinking, oh man, I don't even want to live anymore. They may have just had a suicide attempt.
Right.
And now they're meeting you and they're saying, man, this woman did it. She's a nurse now. She's helping me. She was once where I am.
And you know, like I always thought too, because I actually met a nurse who was in a similar predicament that I was in, like going through struggling basically. And I looked at her and I was like, you know, I can never do that. I could never do that. But then she was like, but you know what? It didn't start off as me just becoming a nurse. Like she started off doing CNA work. And then from there, that
Yep.
turned into like applying to nursing school and going through it and all that kind of stuff, which I was like, oh, okay. Like that seems a lot more doable than just, oh, deciding one day, you know what, you know what I mean? I'm going to be a nurse kind of thing.
Right.
But
And you can do anything you want to do. The two
yeah,
things that are important is one, make a plan, right? Stick with the
goals.
plan,
Yep.
goals. And two, don't try to get in a hurry. There's no
And make
race.
sure it's a goal that is attainable. Because for me,
Right.
when I was like creating goals, they would be like unattainable. And I'm like, wait a second, like, why am I not making any of my goals? And it's like, because like you're wanting to be a nurse tomorrow. Like,
Yeah.
it's not going to happen like that. Like,
No, no, you got to
no.
go through the steps to get there. And there's a good reason for those steps.
Yeah.
And I think that, I believe in my mind that someone will watch this video that needs to see it. And if only one person, just one, decides not to act on a negative situation, let's just put it that way, then
Mm-hmm.
it's worth making this video.
I agree.
If one person
Wholeheartedly.
calls a friend for help, it's worth making this video.
Yep. Reach out. Like, that's the biggest thing. Reach out. Like, I know a lot of people think that, oh, I'm going to be a burden if I reach out. It's like, but you know what? Aren't you there for every person that comes to you?
Call me
So it's like,
if you
okay, so
need
like,
to.
because that's how I used to be. I used to be somebody who would always be there for my friends. If they called me at 2 o'clock in the morning, I'd always pick up the phone. But I would never go to them because I always feared that like I would burden them or like I would
Right.
put all my baggage on them and I didn't want to do that. But it's like, you know what? But you're there for them.
Right.
They would be there for you too. Like you just
Yep.
have to reach out. It's just take that step and reach out. Take that leap of faith and reach out. And what I
Yep.
found is like my friends have been like, why haven't you reached out to me sooner? Like
Yeah.
I would have been there sooner. I'm like, well,
Right.
you know, mental health sucks. But
But it does make us who we are. And
yeah,
and I think that there's, normalizing it and talking about it makes it easier for people that are suffering with it. Because I'm telling you, I couldn't even go into a grocery store without my
yeah,
best friend when I was in
exactly.
college. Couldn't do it. Way
Ugh,
too scared. Thought everybody was looking at me. Thought I was going to have a heart attack. And every time, this is it. Even though I knew that I made it through it 100, 200, 1,000 times before, I convinced myself that this was the time I was going down. And
yeah.
I was never going to wake up.
And once you tell yourself that, it's hard to reverse it. It takes a lot of, so there's a saying, it takes 1,000 I love yous to reverse one I hate you.
Yeah.
So like, cause we as human beings, I feel like we are our own worst critics.
Yep.
But it does not have to be that way though. Like we have the power to change that. We have the choice to change that.
That's right.
It all starts with how we talk to ourselves.
That's
So
right.
would you tell that to your best friend? No, you wouldn't.
That's right.
So talk to yourself how you would your best friend.
And if you tell yourself you love yourself every day when you get up and look in the mirror and you do that every single day, pretty soon you're going to start believing it because your subconscious mind doesn't know the difference.
Yep, your
But
mental
if you wake up and you say, "Oh God, today's going to be a horrible day. I hate my
it's
job.
gonna be a
This
horrible.
sucks. I feel like crap." Yeah. You're setting yourself up, and then you surround yourself with all these people that do nothing but gossip and they're unhappy. You can't do that.
Yeah.
That's exactly, but that's what a lot of people do, right?
Yeah. And you know, I've come to learn that it actually comes from the primitive part of our brain, which is the fight, flight, freeze, or fawn.
Yep.
And a lot of the times we are fawning.
Yeah,
That's the
that's
biggest one
right.
that a lot of people will do, including myself.
Yeah, absolutely.
But again, it does not have to be that way. That's the biggest thing is we have the power to change. Like it's up to us to change. Like I used to think that, oh well, you know, if I can help this person or I can help that person, then I can help them change. But no, it comes from inside.
Yep.
It
They
has to
have
come.
to want to change.
Yeah. First step is with you.
That's right.
And you can do it.
You can. You can do anything.
Yep. Anything you set your
Everybody
mind
out
to.
there, if you're depressed, if you're bipolar, even if you're psychotic, you can get better. You might not be perfectly normal, whatever that word means,
Yeah,
right?
what's
But you can
normal?
definitely
Normal's
get
boring.
better. You can get better.
Yeah.
You can get better.
I
You
heard
just,
this quote. It's better is great, but well is better.
right. That's right. That is exactly right. Okay.
But yeah, one more thing I want to say
One
is
more thing. Let's do
don't
it.
you are not your label. Whatever diagnosis that you have, it's not who you are. That is not who you are.
That's right.
So yeah,
That's
be kind
exactly
to
right.
yourself.
That's exactly right. You are not what your diagnosis is.
Exactly.
Marissa will tell you that. She, everybody knows who Marissa is, I think, that's in here. She's had a lot of medical issues, and she will tell you, I'm not defined by my illnesses.
Exactly.
So
Exactly. And you're beautiful and you're loved. You are enough. You are worthy.
God doesn't make mistakes.
Exactly.
Always remember that when you think you don't belong here.
Exactly. Amen.
Always remember that. And if you don't believe me, ask Kim. She'll tell you the same thing.
Exactly. Kim's awesome.
Yeah. Thank you, Jules.
Yeah. Thank you for having me.
And I will definitely get you on here again whenever you're ready because I knew you would be a good interview. And I would love to hear more about some of the things that have happened to you without details, of course.
Yeah.
Because I think that's another thing that a lot of people keep inside and they don't talk about it.
Gotta talk about it. Yeah.
And that's not healthy.
Nope. Nope, it's not. Therapy. Honestly, you guys, therapy. Like
Yep.
I know a lot of people think that therapy is taboo, but therapy. It's not.
Yep.
It's awesome.
Yep.
So yeah,
Okay.
we'll for sure do this again though.
Yes. Thank you so much.
Yeah, thanks for having me. Bye, you
All right.
guys.
Bye, everybody. Thanks for coming. I'm Pharmacist Michael. Be happy and be healthy. If you have any questions, be sure to leave a comment and I'll get back to you.